Hello there. I didn't see you. I'm a third-year dental student at the OU College of Dentistry. I have many patients ask me all the time about dental implants and implantology consults and just what to expect at the college. Would you like to know a little bit about dental implants? And what to expect at OU? All right, follow me.
Should I be like this? What? I'm Dr. Mo. Nice to meet you. Hey, how you doing? I'm Dr. Khalid.
Hey, how are you? I'm Ollie.
Ollie, nice to meet you. So what brings you in today?
Well, I had a root canal done a couple years back, and then they extracted it, so I've got this space way back here in the back,
Yeah?
and I was kind of wanting to get that space.
Modern dental implants have been around since the early to mid-20th century. They have undergone major changes throughout the years and currently have a high success rate.
So there are actually a few ways that we can fix that missing space between your teeth, and each one has advantages and disadvantages.
One option is the removable partial denture. The main advantage of this is that it is relatively affordable and usually does not require surgery. However, it is less aesthetic and would not be practical for replacing just one tooth. Another option is a type of fixed partial denture known as a bridge. It is more affordable than an implant, it is aesthetic, and usually does not require surgery. A major disadvantage is that it requires the removal of tooth structure on the teeth supporting the bridge. The third option is the dental implant. The implant replaces the root of the missing tooth, and the crown of the implant replaces the actual crown of the previous tooth. The major advantages of the implant are that it is highly aesthetic and is the closest option to a real tooth. However, it is the most expensive of the three options and requires surgery. And lastly, the final option is simply no treatment. Let's see what Ollie wants.
I definitely want the implant.
Alright, let's set up the implantology consult for you. Now if you're a patient here at the OU College of Dentistry, the implant consult is free, unless we need to get a new panoramic x-ray. And the consult takes about 30 to 45 minutes, and we actually leave room for questions.
I definitely want the implant.
Also, the implant costs around $2,000 to $2,500. At the consult, they'll break down the fees for you and explain the procedure in more detail.
Definitely want the implant.
Alright, let's go!
Hi, I'm Dr. Mo. Nice to meet you. Nice to meet you. I hear you're interested in getting a dental implant.
That's right.
Alrighty, well, let me tell you a little bit about dental implants.
A dental implant is a surgical component that replaces the root of a tooth by interfacing with the bone of the jaw or skull in order to support a dental prosthesis. This does not mean that the dental implant will behave and feel just like a natural tooth. In fact, natural teeth are connected to supporting bone by PDL fibers, which act as sort of a miniature shock absorber for the teeth during compressive loads. Current dental implants do not have damping effects because they do not have PDL fibers. After placement of the implant undergoes a process over time called osseointegration, which is the functional connection between living bone and the surface of the implant interface. The implant is made of titanium.
Titanium, is that the same material they use in hip and knee replacements?
Exactly. Titanium is a biocompatible material, meaning that it does not create any adverse reactions in the body when placed, with relatively few exceptions.